service, our trusted team keeps your Honda running like new. Stop by Bryan Honda, 4104 Rayford Road in Fayetteville, North Carolina, or visit us online at BryanHonda.com. Nobody beats a Bryan Honda deal. Not now, not ever.
Did you know Atlantic hurricane season runs through November? From gathering necessary supplies to planning an evacuation route, now is the time to make sure you and your family are prepared. And if a storm damages our electric system, local public power providers are ready to respond and restore power quickly and safely. As a public power customer, you benefit from having an electricity provider that restores power faster than other providers do. Visit electricities.com for storm preparation tips and resources.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're getting straight to the heart of it, literally. Now we're going to talk about heart health. We're going to talk about high blood pressure today, cholesterol, family history, stress, and what we can do right now to take better care of our hearts. Now, because of the topic that we're discussing today, if you or anyone that you love suffer from anything that we may discuss today, what I want you to do is remember that this broadcast is for informational purposes only. This is not a time for you to self-diagnose. So if you suffer from anything that we may discuss today, what I want you to do is find yourself a healthcare professional. And joining me in the studio, ladies and gentlemen, is someone who knows the heart inside and out. His name is Dr. Robert Maughan, and he is a cardiovascular and thoracic surgeon at Cape Fear Valley Health. And he's here with us today so we can break some things down in a way to where we can understand it and we can share the tools that we need to use. So first, Dr. Maughan, welcome back to Making Rounds Live.
Thank you, Omega, and thanks for having me on.
Now, Dr. Maughan, you are a board-certified cardiothoracic surgeon specializing in heart valve disease and comprehensive heart and vascular care. Now, Dr. Maughan, that's a mouthful. So can you tell people exactly what it means and why we might need a specialist like you?
Yeah, so cardiothoracic surgeons is kind of a specialty from surgery. So that's somebody who has done a general surgery training and then has gone on to specialize in cardiac surgery. So that's an extra fellowship.
Okay.
And what we deal with is a lot of the surgical procedures for the heart and for the lung. So cardiac surgeries, bypass surgeries, valve surgeries, and we also do thoracic surgeries or lung resections for cancer and other things.
Okay. Now, let's talk about your history. How did you get into this medical field?
Well, did not have anybody in the medical field within my family. However, I did have a strong family history of heart disease. In fact, my dad died at a very young age from a heart attack. So cardiac disease has been pretty personal to me. When I was in med school, I did some rotations in surgery and did a rotation in cardiac surgery, and after that I was hooked. So from there I went and did a fellowship up in Boston for cardiac surgery, and my first job after training was actually right here in Fayetteville. That was in 1998, and I've been here ever since.
Wow. Ladies and gentlemen, Dr. Robert Maughan with us today. He's our guest on Making Rounds Live. Dr. Maughan, this is a question that I hear a lot in the community. People don't know the difference between general cardiology and a cardiovascular specialist. So what is the difference between the two?
I would say the best way to describe the difference is they're more of the cardiologist is more of a medical management for heart disease. So those are the people you would go to see for your initial evaluation, for cardiac testing, echocardiograms, even stress tests. And they may decide to treat you with medications, or they may do further invasive tests like a cardiac cath. We treat heart disease in different ways. A lot of people are on medications for heart disease. There's a lot of people that wind up getting stents if they have coronary blockages. And there are some people who get referred to cardiac surgery. Those are the patients who would not be good candidates for stents, meaning they probably have more diffuse disease or more blockages than we would recommend stenting. So in those instances, the patients would be referred to me, and we would evaluate them to see if they would be a good candidate for open heart surgery.
Ladies and gentlemen, in the studio, Dr. Robert Maughan with us. He is the cardiovascular and thoracic surgeon at Cape Fear Valley Health. He's our guest today on Making Rounds Live. Now, if you have a question for Dr. Maughan, what I want you to do, two ways you can do this. First of all, you can give us a call at WIDU at 910-483-6111. Again, that number is 910-483-6111. Or if you're following us by way of the Cape Fear Valley social media feed on Facebook, you can drop the question in the comments section, and Lindsay will make sure that we get those questions answered for you. Finally, because of the topic that we're talking about today and because of the information that we are going to bring you today, I want you to share this broadcast. Reason being a middleman, you're going to forget something. So if you share the broadcast, you can just tell them, go to the broadcast, see it for yourself, and then therefore they can get all of the information that we're talking about today. And ladies and gentlemen, again, we are discussing heart health, high blood pressure, cholesterol, family history, stress, and more with Dr. Robert Maughan today on Cape Fear Valley Health's Making Rounds Live. Dr. Maughan, let's talk about your clinic. Cape Fear Valley Cardiovascular and Thoracic Surgery. I know you work with heart and vascular patients, but do you work with different types of heart patients?
So the big thing I like about working down here in Fayetteville is the wide variety of patients that we see and the procedures that we do. We see patients for a variety of heart issues, including coronary artery blockages. We see people for valve issues, heart valve issues, including aortic stenosis, mitral regurg. And we also see patients for thoracic disease, patients with a lung mass that may need a biopsy. We see patients that have been diagnosed with lung cancer that may be a surgical candidate. And we treat a lot of other vascular diseases. I do a lot of carotid surgery. They kind of go hand in hand. The same disease process that causes coronary disease or blockages in the heart can cause blockages in the carotid arteries as well. So all of our patients with heart disease, we kind of screen for carotid disease as well.
Dr. Maughan, at what point should someone start taking heart health seriously? Should it be at the age of 40? Should it be, because personally, I didn't start taking seriously until I got stents. So should someone start at the age of 40 or should they start younger than that?
I would say they should start being concerned about their health as early as possible, especially if you have a family history. As you mentioned, there are some risk factors for heart disease, including hypertension, diabetes, smoking, obesity, and family history. Now, there's not too much you can do about your family history, but there's a lot that you can do with those other risk factors. So the earlier you get started on managing those, as far as hypertension, diabetes, the better off you're going to be long term. So I would say there's no specific age, but the earlier the better.
Dr. Maughan, you mentioned family history. Explain to our listeners how important knowing your family history is.
Yeah, there's definitely a significant risk factor if you have a strong family history of coronary disease or cardiac disease. Hypertension runs in the family, diabetes runs in the family. So all of these things you should have checked at a young age. And if you notice that there is an abnormality, the earlier you get started on treating that, the better off you're going to be long term. So a lot of people are reluctant to, if they have hypertension, they're reluctant to get started on medications. They don't want to be on medication for a long period of their life. But, hypertension is the silent killer, right? So its effects are cumulative over time. So the earlier you get started, the less likely you will wind up seeing me.
Well, Dr. Maughan, I was one of those folks that was in denial. It took me forever to get on blood pressure medicine. And because it took me so long, that's the reason why I have stents. So, ladies and gentlemen, in the studio, Dr. Maughan with us today. Dr. Maughan, let's talk about the Black community. We know that the Black community is at a higher risk for heart disease and stroke. First of all, why is that? And what can we start doing about it, both individually and as a community collectively?
Yeah, I think community-wide, but especially the Black community has a predilection to hypertension. Young Black males typically can develop hypertension at a young age, and a lot of males are reluctant to get started on medications for different reasons. Some of it is because of the side effects of some of the medications. But it's important that you do get started early and treat these conditions, because treating them early, like I said, is going to lead to less complications down the road, and you'll be in better health for a longer period of time. So it's very important that even though you may be reluctant to look at these things or acknowledge them, certainly the Black community is at higher risk for hypertension and diabetes.
You mentioned side effects, and I know this wasn't one of the questions but the side effects, and I already know one of the side effects is the sexual end of everything. But my personal opinion on that, Dr. Maughan, is that if you're dead, that's not going to make any difference. So explain the side effects and why they should still take the medication in lieu of the side effects.
Yeah, I think you have to be conscious of your overall health, right? And if you're not around to enjoy things, it doesn't matter.
That's it.
So definitely, no matter what you do, there's going to be side effects. The beta blockers, which we typically use for heart disease, can make you feel tired. You can lose that sexual drive. But there are a lot of different medications, and it may mean adjusting some of those medications and figure out which ones work best for you. But I think the worst answer is to leave it alone. If you leave it alone, you're not going to be around long enough to enjoy it.
Exactly. Let's talk about the certain groups or age ranges that you see in your office that are more affected by heart problems. Which one would that be?
I would say typically now we see a lot of older patients. In the past, we would see younger patients coming for heart surgery. But now the cardiologists have been very effective at treating a lot of heart disease with medications, with stents, so that typically we'll see patients at a later stage in their life. They've already maybe been tried on medications, they've had stents placed. Mm-hmm. Either they get restenosis in the stents, or they develop more blockages in locations that are not ideal for putting in stents. Mm-hmm. And then they get referred to us. I think surgery probably offers a better long-term fix than stents, but it does require obviously a bigger procedure to get you there.
Mm-hmm. Let's talk about food, Dr. Maughan. Can you give us one food that you would always recommend for adding and cutting back?
That's a good question, but I don't know that there's any single food that I would recommend. I think in general, we should try to avoid fatty foods and fried foods. So if you had to remove one thing from your diet, I would say instead of frying food, you bake it or do something different with it. And certainly adding more vegetables is always a good idea.
Okay, well, you said no more frying food. Well, Dr. Maughan, you just knocked out soul food. So we know it's not good for the heart, but we know that in the Black community, our culture, that's what we do, that's what we eat. Are there ways that we can make healthier choices?
So I think with regards to soul food, and I'm no expert on soul food, however, I know that there are different ways that you can prepare it. There are different ingredients that you can use. You can use leaner meats, more beans, more vegetables, and avoid as little frying as possible. As Helen, who's worked with me for many years, says, taking the sodium out of soul food doesn't take the soul out of it. So.
I was getting ready to call her in if we didn't get it in there.
So lowering the sodium content of the food certainly helps with regards to hypertension and overall health.
Ladies and gentlemen, in the studio, Dr. Robert Maughan. He is a cardiovascular and thoracic surgeon with Cape Fear Valley Health, and he's our guest today on Cape Fear Valley Health's Making Rounds Live. We are talking about heart health, high blood pressure, the whole nine today. And Dr. Maughan, let's talk about sleep. Because a lot of people don't see the correlation between sleep and heart disease. So how big of a deal is rest when it comes to heart health?
I think sleep is important for not only heart health, but for overall health, because your body needs time to relax and recover. So if you're not getting enough sleep, that puts extra stress on the body. And stress has been shown to increase the inflammatory response to the body, which is detrimental for heart disease, vascular disease, strokes, and other things. So getting enough sleep is very important. And I would say, in order to do that, you need to set up a kind of a regimen where you go to sleep at the same time every night and try to set yourself up with a good routine so that you get at least, I would say, about 7 hours of sleep a night.
7 hours?
If possible.
I was going to say, people in radio, we don't do 7 hours, Dr. Maughan. We average 3, maybe 4 hours. So, ladies and gentlemen, Dr. Maughan with us today on Cape Fear Valley Health's Making Rounds Live. Dr. Maughan, let's talk cholesterol. What role does cholesterol play in heart disease, and how can people manage that?
So cholesterol has been a big risk factor for heart disease for a long time. We've known that high cholesterol can significantly contribute to heart disease, especially over a long period of time. Fortunately, there are a lot of medications available now to help reduce your cholesterol levels. These are known as statins. These are very well tolerated. They're very effective at lowering cholesterol and have been shown to significantly improve overall longevity with regards to heart disease. The first step, I would say, would be to change your diet around, however. If you can get your cholesterol down with exercise and dieting, that would be the first step. Then, if your cholesterol is still high, then try one of the medications like a statin.
Dr. Maughan, for folks that don't really understand cholesterol, explain what causes it.
Well, cholesterol is naturally occurring in your body, but an excess level of cholesterol can increase the amount of plaque buildup in the arteries, which can lead to problems with regards to blockages in blood flow or pieces of plaque breaking off and causing problems such as heart attacks and strokes. So keeping your cholesterol under control or using these statins, which can help lower cholesterol and also help stabilize some of those plaques, may definitely be beneficial to help reduce heart disease and strokes.
Let's talk about overweight and obesity. Big problem here in the Sandhills and the Bible Belt. Does being overweight and obese, does that affect your health?
There's definitely a correlation between obesity and heart health. And not only does it cause problems with your heart, but your overall health. So we see a lot of people who are overweight that if they can lose weight, exercise, eat better, they can actually, get better control of their blood pressure. So they may be able to come off some of the hypertensive medications. They can get better control of their sugar, so maybe even come off some of their diabetic medications. Obesity also plays a role, if you do need surgery. Being obese makes healing more difficult. It makes ambulating after a procedure more difficult. So it definitely contributes to your risk factors during surgery and afterwards.
Let's talk about the high blood pressure, since you mentioned it. High blood pressure, can that actually be reversed, or is that basically something that you're pretty much going to have to manage for the rest of your life?
I would say most people with hypertension have essential hypertension, which is going to require treatment and control rather than cure. There are a few types of hypertension caused by tumors and things which can be cured with tumor excision and things, but for the most part, hypertension is something that's going to need to be controlled. But luckily, there are plenty of medications around to help control hypertension, and sometimes it's just a matter of finding which medications work best for you with a minimal amount of side effects.
Ladies and gentlemen, on today's broadcast, Dr. Robert Maughan. He is a cardiovascular and thoracic surgeon for Cape Fear Valley Health, and he's our guest today. Now, if you have a question for Dr. Maughan, what you can do is call WIDU at 910-483-6111. Again, 910-483-6111. Or if you're following us by way of the Facebook feed on Cape Fear Valley's Facebook feed. Can I talk today, please? You can drop the question in the comments section, and we'll get that question answered for you today. Finally, what I want you to do is, because of all of the valuable information that we're discussing, I want you to share the broadcast. Share the broadcast. Don't ask questions, just share it. And again, we're talking about heart health today. We're talking high blood pressure, cholesterol, family history, stress, and more with Dr. Robert Maughan. He is a cardiovascular and thoracic surgeon for Cape Fear Valley Health. Now, Dr. Maughan, a lot of people around here deal with high blood pressure and diabetes. How do these two conditions impact the heart?
I think those two conditions are cumulative. So, each individual proposes significant risk, but together they significantly contribute to the amount of heart disease. So, and a lot of things that you can do as far as exercise, changing your diet, can help with both of those things. So I would stress, before trying medications and things, you work on changing your lifestyle. And most of the time that will help improve those.
If your parents have heart trouble, does that mean that you're guaranteed to have it too?
I hope not, but unfortunately, genetics do play a significant role in heart disease. So knowing your family history is very important, but then acting on that is also important, right? You may know that you're at high risk for heart disease, but being proactive and finding out more about your health, including blood pressure, sugar, will certainly help. Because no one is going to care more about your health than you do. So I would stress being more proactive as far as finding out about your history and then dealing with it.
In other words, don't listen to the people that say, we don't talk about that. Learn your family history. So that's why I say that. So Dr. Maughan, let's talk about screenings and tests. What kinds of screenings and tests should people ask for when they go to their doctor, especially, once again, if we say that you have a family history of heart problems and heart disease?
Yeah, I think it's important, again, that you be very proactive. And if you know you're at risk for heart disease, there are certain things you can do. Make sure you have your blood pressure checked. Mm-hmm. When you go to see your primary care, have your cholesterol levels checked, as well as your sugar. And if you're developing any symptoms, if you notice that you get chest pain when you're doing things, or you become more short of breath with activities that you normally did without any problems, now you're starting to notice that you're getting a little more short of breath and can't do the things you want to do anymore, that's when you need to be pretty aggressive and make sure that those things are worked up, whether it's with your primary care or with a referral to a cardiologist, a medical cardiologist.
And another question that just came to mind, Dr. Maughan, one thing that I've noticed when it comes to heart disease and heart health and that type of thing, I've noticed that men and women don't have the same symptoms. Like before Darvin passed, Darvin had shortness of breath. He had chest pain. Me, I just had severe heartburn.
Yeah, women are very difficult.
You just had a whole lot of men saying, yes, they are, Dr. Maughan.
For many reasons. But one of those is the ability to diagnose heart disease, because women do have different symptoms. Men are typically complain of the classic symptoms, chest pain, chest pressure, radiating to the arm, usually the left arm. Women are different. Women can present in different ways. Sometimes it may be just a pain in their neck or their chest. Sometimes it's just with symptoms of indigestion. So it may be a little more difficult to diagnose. But I don't think we should underestimate those symptoms. And knowing that women don't always present in a classical fashion, we should be a little more aggressive with working them up and not just assuming that it's something emotional or something GI related.
Ladies and gentlemen, Dr. Robert Maughan, a cardiovascular and thoracic surgeon at Cape Fear Valley Health, and he's our guest today on Making Rounds Live. Dr. Maughan, what are some of the common heart and blood vessel problems that you are seeing on a day-to-day basis at your practice?
So with our practice being a cardiac surgeon, we are generally referred patients that have already been worked up by the cardiologist. So they've usually seen a cardiologist, maybe had a stress test. If that's abnormal, then they go for further studies such as a cardiac catheterization, where they inject contrast or dye into the coronary arteries. And that will tell you whether you have any coronary blockages. Now, after that, the treatment can be different things. Sometimes, like I mentioned, some people may not be candidates for other interventions and get started on medications. A lot of people get stents, and then some people get referred for surgery, so they come to see me. And there's different reasons for that. Sometimes the blockages are in locations that are not good for stenting. People with what we call left main disease, which is kind of the trunk of the tree that gives off two big branches that supply the heart, is a difficult area to put a stent in. But it could be life-threatening. So those are the patients that usually do better with bypass surgery. Now, bypass surgery is a little bit different than stenting. With stenting, it kind of pushed the plaque out of the way and reopen up that artery. Surgery is different in that we don't do anything to the blockages that are there. We basically give the blood another route to take to get around those blockages. So we essentially bypass those. So surgery can usually offer a better long-term fix so that people live longer and they're able to do more things for a longer period of time.
Now, Dr. Maughan, are there other types of heart issues not caused by aging or lifestyle that that Cape Fear Valley Health's cardiothoracic surgeons treat?
We treat other heart conditions, not just blockages in the arteries, but we also treat valvular disease. Some people can have congenital problems with their valves, rheumatic heart disease, where the valves, which are basically the doorways that the heart has to keep the blood going in one direction, those doorways can either get narrowed or it can become leaky. Either way, they can develop into problems. And we can address those surgically by either replacing those valves or by repairing those valves, again, requiring heart surgery to do that.
Now, let's talk about TAVR. What exactly does it stand for, so our listeners will know? And what heart conditions does TAVR treat, and how does it work? That's a three-part question, so I apologize for that. So what does it stand for? What conditions does it treat? And how does it work?
Yeah, we throw around a lot of terms. We talk about TAVRs, SAVRs. And basically, when we refer to a TAVR, and these all have to do with aortic valve disease. So a TAVR is transcatheter aortic valve replacement. A SAVR, S-A-V-R, would be surgical aortic valve replacement. Now, in the past, we didn't have TAVRs, so everybody that needed their aortic valve replaced or repaired underwent surgery, usually requiring a sternotomy, put on a bypass machine, and a stay in the hospital for usually 5 or 6 days. The surgery was very effective. It cured the problem, and people generally did very well with it. More recently, I would say within the last 10 years or so, the TAVR procedure has become very popular. So TAVR basically accomplishes the same thing. It pushes the old valve out of the way and puts a new valve in there, but the procedure is performed percutaneously. So we usually go through the groin, similar to a cardiac catheterization, but with a little bit bigger catheters. That catheter goes up, and we use fluoroscopy or x-rays to make sure the new device is in the right position. But it basically pushes that old valve out of the way and positions a new valve there. And it's been very effective. The results have been very good. And I would say the biggest difference is the recovery period. So with a TAVR, since we don't have to do a sternotomy, patients have come in that day of the procedure. They have the procedure done. Procedure usually takes about an hour and a half or so. They spend the night in our intensive care unit. The next day, they walk around, they eat breakfast. We check an echocardiogram, make sure the valve function looks good. And if everything looks good, they go home that next day. So the recovery with a TAVR is much easier than the recovery with a SAVR, or surgical valve. Now, there are still indications where we do surgical valves. There may be patients who are not candidates for TAVR based on the anatomy of the valve, not having access to get up through the groin. There are some patients, including younger patients, who may do better with a surgical valve initially to get all of that old valve, that calcified old valve out of the way, allow us to put a bigger valve in there, knowing that down the road they're probably going to need a second procedure.
Since you mentioned that, is there a time limit on how long the TAVR will last?
So we don't have a lot of long-term data, meaning we don't have the 20-year data on the TAVR valves. But so far, the 10-year data looks very good as far as being consistent with our surgical valves. Now, the valves that we put in with a TAVR have to be a bioprosthetic valve. There's two basic types of valves. There's a mechanical valve and a bioprosthetic valve. The mechanical valve is made out of metal. The good thing about that is it'll last forever. It'll never wear out. The bioprosthetic valves will wear out over time. The benefit there is that you don't have to take a blood thinner or anticoagulation for life. But with the advent of TAVR, we can now do TAVR within a TAVR. So as long as that valve is big enough, if the patient does need a second procedure, we could put another valve inside the old TAVR valve.
Oh, okay. Ladies and gentlemen, Dr. Robert Maughan with us today. We are talking heart health and more on Cape Fear Valley Health's Making Rounds Live. Dr. Maughan, since we're going up to the top of the hour, there are a couple of questions that I really want to ask you before we go. I heard that you've added 2 more full-time surgeons to your cardiovascular and thoracic team. How does having a larger team benefit a patient here?
So I think that's probably one of the biggest things that's happened here to our cardiac surgery program in a long time. We have been very fortunate to get 2 new surgeons. One is a Dr. Celio, who started with us 2 months ago. And this third surgeon that's going to be coming in August is a Dr. Huttinger, who actually did his surgery residency here at Cape Fear Valley.
Really?
Went on to do his cardiac fellowship at ECU and is going to come back to Cape Fear Valley to work as a cardiac surgeon. So we're very thankful for him coming back. We're looking forward to him working here, as well as Dr. Celio, for a long, long time. So what that does is it provides us with consistent care for our patients. So instead of having a single surgeon with occasional what we call locums physicians covering, we will now have 3 surgeons living in the community.
That's great.
That will be here and covering 100% of the time.
That is awesome. Ladies and gentlemen, in the studio, Dr. Robert Maughan with us today. He's our guest on Cape Fear Valley Health's Making Rounds Live. We're talking heart health, and we brought him in because he knows the heart inside and out. Now, Dr. Maughan, I want to touch on heart valve disease real quick. What is it, and how is it treated compared to how is it treated today, rather, compared to, let's say, years ago?
I'd say the biggest advances in heart valve disease has come with this TAVR procedure. So aortic stenosis is a narrowing of the aortic valve. It's usually a progressive disease, so people have it for a while. And it's only when it becomes what we call severe or critical that it starts causing problems. And usually that presents later in life. So a lot of these patients in the past may not have been great candidates for surgery. So we would sometimes see patients and have to turn them down because the risk of surgery was higher than the risk of leaving it alone. With this TAVR procedure, we can now fix or replace those valves in some of these patients that would not be candidates for surgery in the past. So we're doing a lot more aortic valve replacements, and people are doing very well with this. So age is not such a big factor anymore. We've put TAVR valves in 80, 90-year-olds, and they generally tolerate the procedure very well.
Dr. Maughan, can you break down the difference between a bypass and a stent? We've talked about both of them this morning, and even though I know what one is because I have stents, so what is the difference between the two?
So think of a stent as kind of plowing through a blocked road and getting that road open again. And the stent kind of pushes the plaque out of the way and allows the blood to go down that artery again. Stents are very effective and they usually work very well. They can, however, get blockages within the stents over time, and you can only kind of do that a certain number of times. You can't put too many stents within stents. Bypass surgery is a little bit different. We don't open up those blockages, but it would be equivalent to placing a new road right next to the old road and giving that blood a new avenue to get to that part of the heart. We typically use conduits or grafts from the chest wall, the mammary artery. We use almost 100% of the time. Mm-hmm. And then we usually use some vein from the leg to do those bypasses with. I would say bypass surgery offers the opportunity to more completely revascularize the heart, meaning we can bypass many blockages while we're in there. And it offers a more long-term fix than stenting.
Now, bypass and CABG, is that the same thing?
Correct. Coronary
Okay.
artery bypass grafting, also known as CABG.
And when will a patient need one?
So usually, like I said, there are different ways we treat heart disease: medications, stents, and surgery. The people that need CABGs are either people that have failed stents, meaning they've developed in-stent restenosis or have complete blockages of the arteries where they cannot open those arteries to put a stent in. Or the location of the blockages is such that putting a stent in may be too high a risk for the patient, and they would be better off or lower risk to bypass those blockages.
Mm-hmm. Let's talk about heart valve surgeries. What are they and how do they help a patient?
Like we discussed, Omega, the heart valves keep the blood flowing in one direction within the heart. And if those valves become diseased or stenotic, they can restrict the amount of blood that can leave the heart. and cause blood to back up in the lungs or the extremities, causing shortness of breath, congestive heart failure, or those valves can become incompetent or leaking, and again, blood can back up and cause problems. Typically, we'll initially manage those valve issues medically, but when they become severe or we see that the heart function is starting to deteriorate, we talk about fixing or replacing those valves. The mitral valve, one of the heart valves between the left atrium and left ventricle, we can generally try to repair as a first option, or replace if repair is not effective. The aortic valve, as it becomes more stenotic, generally we tend to replace that.
Okay. Now, we were talking about lung cancer earlier, Dr. Maughan. Is that when someone would have a lung resection?
Correct. Now we see a lot of lung patients for different reasons. Sometimes people get a chest x-ray, and nowadays anybody with a significant smoking history should get a low-dose CT scan to look for any lung nodules or lung masses. Sometimes, though, they will have biopsies, and those biopsies will have a diagnosis of lung cancer, in which case they'll get sent to me. When we look at a patient with a lung mass or lung cancer, we look at a few things. The best treatment for lung cancer, if at all possible, is to take it out. That's your best chance of cure. But before we decide whether or not that mass can be taken out, we have to make sure that the cancer hasn't spread elsewhere in the body. We want to make sure that their lung function is good enough that I can take out part of the lung and leave them with enough lung that they can breathe and come off oxygen and do normal activities. And we want to make sure that they're in good heart shape to tolerate a procedure. But if they do have a lung mass and it is cancer and they are good candidates for surgery, then typically what we'll do is what we call a lobectomy, or removal of not just the mass, but of that part of the lung and all of the lymph nodes associated with that part.
Ladies and gentlemen, we're discussing heart health, high blood pressure, cholesterol, family history, stress, and more with Dr. Robert Maughan. He is a cardiovascular thoracic surgeon at Cape Fear Valley Health, and he's our guest today on Cape Fear Valley Health's Making Rounds Live. Dr. Maughan, what should carotid surgery involve, and why is it important?
So we see a lot of people with heart disease can also have carotid disease. Again, it's the same disease process that causes these plaques to build up. And there's a few critical areas, the carotids, coronaries in the heart, and also people can have peripheral vascular disease from the same disease process. Now, we worry about coronary disease because that can cause heart attacks if you get blockages there. And for that, we do bypasses or stents. For carotid disease, that can cause strokes, which can be terrible in itself. So when we see people with significant carotid disease or symptomatic carotid disease, meaning they've had mini strokes or TIAs, we talk to them about a procedure called carotid endarterectomy, which is an operation. We go through the neck and actually clean out that blockage in the carotid artery.
Wow.
So it works real well as far as preventing strokes down the road, and usually is a one-time deal, meaning once you clean that artery out, usually it's good for a lifetime.
Right. Dr. Maughan, let's talk procedures real quick. Has heart surgery changed over the past 10, 20 years?
Absolutely. Along with everything else in medicine, things change over time and they generally get better. So we have newer procedures to diagnose disease. We have better procedures as far as revascularizing. We use different conduits for the bypasses. The surgical part of the procedure has continued to improve with shorter operating times, quicker extubation of the patient in post-op. So we try to get them the breathing tube out off the ventilator faster. Getting patients mobilized faster tends to reduce complications after surgery. We rely on a lot of our team. It's a team process. So we rely on our anesthesiologists, our intensivists in the ICU, our APPs, or advanced practice people, including nurse practitioners and physician assistants, to kind of get these patients mobilized faster and home faster.
All right, Dr. Maughan, since we're coming up on the final 3 minutes of the program, aspirin, people 50 years and older recommended to take one. Is that changed?
So we used to put everybody on aspirin, and that was very common. Now there's been studies that show that if you don't have any significant history of coronary disease, no family history, then you probably don't need it, because every medication can cause problems. And aspirin is an antiplatelet agent. It can increase your risk for bleeding issues and such. But I would stress, if anybody has any cardiac history, then an aspirin a day is certainly one of the best medications that you can take. And usually it doesn't matter, 81 milligrams usually suffices once a day.
That was my next question. Which milligram do we use? All right, Dr. Maughan, heart disease, can it be cured or is it just managed?
Most of the time we're managing it.
Okay.
We like to think that we cure heart disease when we take somebody to surgery and we bypass their blockages. But unfortunately, it prolongs the process, so it takes care of the blockages that you have. But we always stress with our patients that it doesn't cure the disease. So you still have to watch your diet, you have to exercise, because you can get blockages in other areas of the heart. You can get blockages in the grafts that we use. So very important to not just think that you're cured after heart surgery.
In other words, don't go smoking right after heart surgery. 'Cause I do know people that have done that, Dr. Maughan.
Oh, I know.
Okay, Dr. Maughan, before we let you go, what is the one thing that you want listeners to take away from this interview today?
I would just stress to people to be more proactive about their health. Don't wait till it's too late and you're coming to see me, right? So go see your doctor. You know smoking is bad. You know fatty foods are bad. So like I said, no one's going to care about you more than yourselves. So start early and follow up on it.
And on that note, that's a word right there, ladies and gentlemen. Ladies and gentlemen, Dr. Robert Maughan, he has been our guest today. Dr. Maughan, thank you so much for taking time out of your busy schedule to be with us today.
I appreciate you having me, Omega.
And ladies and gentlemen, our next broadcast is Tuesday, August 12th, and we are going to talk about the upcoming Umoja Festival. And you know, during the Umoja Festival, they award the scholarship in Darwin's name. So we're definitely going to be talking about that on August 12th. So for our producers, Shaka Jordan, Ray Thomas, and Lindsey Graham, and the amazing team working behind the scenes, I'm Omega Jones, continuing the legacy of Darwin Jones. Thank you so much for listening and watching Cape Fear Valley Health's Making Rounds Live. Make sure you join us next time.